I'm a medical doctor. I studied medicine at St Mary's Hospital, which is part of Imperial College. During that time I evolved my specialty interest in anaesthetics, which is head and neck anaesthesia. The statistics say that there's about 40% of patients who will sort of delay going to see a dentist because they're worried about just even setting foot in the practice. They're worried about their treatment, they may be phobic. You know, what we want to do is to make it as easy as possible for patients to get their treatment. And hopefully, you know, with good sedation, it may be possible that they then become more familiar and comfortable in the dental environment and able to tolerate more and more without sedation. Depending on what sort of treatment you're having, if it's a quick checkup, then you don't need as much, and then there's slightly different guidelines. But if you're coming in, for example, for a filling, let's say keep it something simple, so a half an hour, 45-minute procedure, what we would expect you to do is you can have something light to eat 2 to 3 hours before the procedure, and we want you to stop drinking at about 2 hours before the procedure. You come in to see us, and you come into the dental chair, and we'll pop some local anaesthetic cream onto your hand, which numbs the skin over the hand, and then we'll insert a cannula, which is a little needle, which stays in the vein, and we can administer the anaesthetic through that. So it's an intravenous anaesthetic agent. Most commonly we would use midazolam, which is a benzodiazepine, and basically it relaxes you. It is also an amnesic, so from the point at which you have it, you probably won't be able to remember from that point onwards. We aim to keep you conscious so that you can talk to us, and that's a really good safety endpoint for us. We don't want to over-sedate you. What we want to be able to do is to talk to you and make sure you're all right, get you to open your mouth, you know, do all the things that dentists need you to do, but you're probably so relaxed you probably won't remember any of it, and you might just drift in and out of sleep, and that would be probably the perfect sedation. What we want to do here at Keppel Advanced Dentistry is to set up a unit that has everything we need. For me, doing sedation outside of normal settings it's really important that you get it right, because you don't have the normal safety barriers that you do in a hospital, for example. So the setup of the whole unit is absolutely essential. It's a great team that knows what they're doing, that's got all the right equipment, and that you know is properly set up.